we'll start off with Vanessa. You were the first with your hands up, and I appreciate that. Go ahead, ma'am.
Thank you so much for taking my question. Hope everyone's doing well. From what I gathered from this press release, it looks like it's going to be a bit of a ramp down of testing on DHEC's part. Is this a signal that we are finally making the transition to endemic? And what sort of scientific and data signals tell us that this is the appropriate response right now?
Certainly. So it is a ramping down, but even more than that, it's a shifting just in the overall strategy. So by looking at the different type of tests that we're emphasizing, that's really come about not so much because of the endemic, though it will contribute to that, but because they are more readily available, they are more accurate, and that they lead to being able to take appropriate public health action sooner. Somebody knows faster that they're positive, that they're infected. They know to then getting pop-ups. So they know then to isolate and not expose others. Looking then at who is getting tested, that is a bit of a ramping down. And so that is looking more, putting the emphasis more on people who have symptoms. And then of course, those who have been exposed know they've been exposed and are getting tested as part of that, close contact recommendation. This is one of the steps towards this becoming more of an endemic response more to COVID-19. There are multiple steps. It is not an overnight process, but this is one big step in that direction. And it's coming about because of the numbers and the indicators that we're seeing and what we're seeing with the variant. Again, this variant, Omicron, that's by far and away the dominant one. While it is more contagious than previous ones, it is less severe. It causes less severe illness. So we're really shifting more of our focus away from necessarily case counts and more towards indicators of severity. And so this again all goes hand in hand together to make forward progress as we move out of a pandemic response and more to an endemic response.
Thank you for your question. We did have one in the chat before I get to you, Damien, just sort of asking if you could make just a brief summary of what the changes are.
Sure. So DHEC is going to be changing, again, two main things as part of our testing strategy. The first of those is the change in testing type and what focus we're putting on, which type we're focusing on. So we're going to be shifting away from our drive-through or drive-up PCR testing sites and more towards handing out. It's going to be available at all of our health departments like they have been, handing out the at-home rapid antigen tests. So that people can do it in the convenience of their home, get tested, have a result, like I said, right away, not having that waiting time, and know how to respond to prevent themselves from spreading it to others. The other piece that is shifting as part of our testing strategy is who we're recommending to get tested. And we're going away from more of the routine screening testing and performing that on large numbers of people and putting the focus on people who have symptoms and who have been exposed as part of as a close contact to somebody who was positive. And so through that, we will do it over the course of the next roughly month or month and a half. Tests will still be available for everyone in the state. We will still ensure that there is access to testing for COVID-19 for everyone. But it's going to be shifting more towards picking up that kit, that at-home rapid antigen test kit from your health department, rather than driving to a big drive-through PCR testing site. And then particularly making sure that the focus when you're getting tested is on, if you have symptoms, please get tested. With that rapid test, you have an answer right away. You can isolate and take those precautions to not spread it further.
Thank you, Dr. Traxler. So we had another question in the chat box. I don't want to jump on people who have their hands up. So Lynn, if you could throw your hand up and I'll get to you in the order in which it goes up. Damien, you're up next, sir. Please go ahead.
Yes, thank you for your time. So you're talking about this kind of a shift in strategy. It's also a shift in actual resources. There are a lot of human and logistical resources that went into these drive-through testing events throughout the state. Where are those resources going? How are they going to be put to use since they're no longer being used in these PCR testing lines?
Certainly, and so those PCR testing lines have really been conducted by both our partners, vendors that we contract with, that have been able to ramp up or down depending on needs. But then the other piece would be certainly our DHEC teams that have been doing that. And we will be continuing to use those individuals as DHEC folks, but they will be more involved in giving out the rapid test kits, or maybe even we're discussing some potential mobile rapid testing groups, almost strike teams for rapid testing. And so we'll be repurposing folks to still use their expertise, but just in slightly different ways.
Thank you, Damian. Simon, go ahead, sir.
Hi, Dr. Traxler. What is your advice for people who look to case reporting to know the level of spread in their area and how they're going to go about their daily lives?
Sure. And so that's going to be, I think, part of the shift that we'll be seeing, again, is also the change in our reporting that'll be coming up in about a month, is really helping people to shift out of a pandemic mindset and what they're looking at, and more towards that endemic, mindset. And so rather than looking necessarily at every day, we're going to be shifting to people looking more at every week. I can tell you that for quite a while, I have been more focused on trends weekly rather than trends day to day for quite some time. And so I encourage people to start making that shift in mindset and what they're looking at. And then again, moving away from the cases, because as we've already discussed, as these rapid tests have become more available and people have started using them more, our counts have likely been underrepresenting. And so that will just continue. So what I encourage people to do, especially as this virus is becoming just endemic, is look at the severity measures. Look at the hospitalizations. We're going to continue reporting that information. Look at the number of people, especially in hospitals, that are needing critical care and resources. And unfortunately, then it remains a lagging indicator, but then deaths is certainly an indicator of severity. So it will take some change in approach and mindset for what people look at, but it's what the public health officials and the experts are doing and have been doing for quite a while, is shifting more towards weekly trends and more towards the measures of severity.
Thank you for that question. Gavin, go ahead, sir.
Hey, Dr. Traxler, just a quick follow-up to that. So I'm wondering, have you guys looked at any other states doing this kind of transition to this kind of reporting? And also, do you foresee it becoming more like DHEC's weekly flu report, essentially?
So there are other states that are doing this. Many of the states have shifted their reporting strategies, especially in terms of reporting more on a weekly basis. I have frequent calls with my counterparts in other southeastern states, and a number of them, some of them even several months ago, have gone to weekly reports. And I don't know that it will look exactly like our Flu Watch report does every week, but similar. I think that the goal for much of this with COVID-19 is, as we recognize it's going to be here with us, but we're aiming to get it endemic, is to have more of an approach similar. It won't be identical, but similar to what we do for influenza.
Thank you, Gavin. Alex, guest, go ahead, sir, or ma'am.
And thanks, Dr. Traxler, for taking my question. Alex Tejada with ABC Columbia News. I would like to, I see the fully vaccinated rate is still under 55%, roughly around 54%. Are we able to get back to normal here in that state with such a low vaccination rate, or is it kind of, if you're vaccinated, do your thing, if you're not, kind of beware?
So certainly people who are not fully vaccinated and need to be aware that they are at higher risk, and they need to take that into consideration when deciding what precautions to take individually and when they're out and about. And I would say that also goes for people fully vaccinated but have not received their booster shot. But we also have, in addition to that, you're right, just under 55% fully vaccinated. We also do have a significant amount of natural immunity, especially after Omicron surge. And related to that, I still strongly encourage people to get vaccinated because we don't know for certain that there's not going to be another variant somewhere down the line that might be more severe and won't continue the trend that Omicron did of less severity. And so I do encourage people to get vaccinated now while you have the opportunity before there's something, bad that comes along. But in general, I think that that our immunity between natural immunity and vaccinations, combined with the changes that we're seeing in the virus itself and the severity that it causes, allow us to proceed towards a more endemic response.
Hey, thank you for your question, Alex. Julia, go ahead.
Hi, Dr. Traxler. So my question regards to you guys pointing to the at-home tests. So there was guidance put out previously that, maybe don't be so trusting of these at-home tests. Maybe that might be giving you a false negative. Now there's shift saying that these are the best tool for us to use. So can you just elaborate on where that shift occurred and why?
Certainly, and I can't point to one specific point in time because it's been an evolution. But there has been improvements. There have been improvements in the accuracy of the at-home rapid tests, and combining that with the knowledge that they still are extremely accurate. They might not be quite as accurate as PCR, but they're still now extremely good and extremely accurate. That small amount of accuracy that may be lost is made up for by having rapid results that allow people to take action. They allow them to isolate and stop spreading it earlier. That 1 or 2 days even, that you're not having to wait for a result can prevent a lot of potential exposures and a lot of potential further spread. And so it's looking at the balance of that and combined with the improvements, and I suspect what will continue to be improvements in the accuracy of the rapid tests. But my overall message is trust the rapid tests, especially if you're following the directions on them when you perform it.
Thank you for your question. Vanessa, go ahead.
Hi, I wanted to see if I could follow up on the discussion that we just had about shifting towards weekly metrics monitoring and more of a focus on hospitalizations, deaths, and severe disease. I heard you discuss perhaps a little bit more accuracy that we can gain by looking at that metric. I was wondering if this is also maybe just a signal that we're now going to start focusing on strictly the burden that the virus would be putting on the healthcare system, and obviously the severe disease impact that it would have on the community.
Certainly, and so that is indicative. The shift is indicative of that. It is not just looking at the burden that it's putting on our healthcare system, though that is certainly important and something that we monitor closely. But it is also, as you pointed out, looking at the severity. And so looking at how many people are getting hospitalized, how many people are not just having mild cold-like symptoms, but how many people are truly having significant illness from this.
Thank you for your follow-up. Damien, go ahead with your follow-up, sir.
Yes, thank you. I'm going to try and squeeze in a quick two-parter here. Sorry. Have there been any decisions regarding school data reporting? And I forgot what my second part is, so that's the one part.
Well, that takes care of the two-part then. So yes, we are looking at the school, the contact tracing, our school guidance, all of that, which certainly goes along with, with reporting. And we do anticipate that there will be some changes likely coming next week, but we are still evaluating all of that to make those final decisions.
Damien, I was going to give you a chance to remember the second one, but let's go ahead to Simon. Go ahead, sir.
You've done a great job explaining the response to or an endemic response, but I just wanted to ask if you could go a little bit into the science of an endemic and more people either getting antibodies through vaccination or infection or both, and kind of the roadmap to surviving with or alongside coexisting with the virus. And I just wanted to start by asking, is South Carolina showing signs that we're beginning this trip forward?
So an endemic is when a virus or a disease is circulating in a certain population or area, and it remains in low levels pretty much constantly, or at least with consistent variability, such as the seasonal flu, but is not causing such severe cases and in such large numbers of severe cases or even deaths that it is significantly disruptive, and we're putting people at high risk. And so we are moving towards that. I think certainly seeing our declines in case counts. Again, it's partially a matter of what is happening with the virus itself. As the virus has become less severe, or has become to the point where it's causing less severe illness, that is a big step. Certainly then the amount of immunity that a population has, when looking at that also as a step. And then just sheer numbers, because not only have our cases been decreasing, but our hospitalizations have been decreasing. Our deaths we haven't seen decreasing yet, but that's again because that's what we call a lagging indicator. And so it usually shows up a little bit later, but I fully anticipate that we will, before too long, begin seeing that decrease that matches that decrease that we've seen in cases and in hospitalizations and in people in the hospital who are needing critical care.
Thank you for your question. Vanessa, do you have a follow-up?
I do, thank you. I wanted to ask about something that y'all had put out a press release about earlier this week, and it had to do with the maternal vaccines and the study that the CDC just released. I just wanted to see if you could speak a bit about what we've learned from that study and what that means for expectant mothers.
Certainly, and so that study really was yet another piece of data that shows how important vaccination is for pregnant people. It not only is helping protect that individual who's pregnant against severe illness in them and potentially poor outcomes with the baby, but it's also helping to protect the baby for up to 6 months after they're born, which to me is very significant because, again, we're anticipating before too long vaccines will be available down to everyone as young as 6 months old. So everyone else in society will be eligible. And so by getting these people vaccinated while they're pregnant and then passing their antibodies on to their baby, it helps bridge that gap, and those babies then are protected until they're old enough to be eligible for vaccination. So we know that vaccination in pregnant folks does 3 things. It reduces their chance of severe disease in that person themselves. It reduces the risk of a poor pregnancy outcome for their baby. And then now we know, based on data, that it helps protect their baby in those first important months of life.
Thank you for that. Lynn, I'm glad you popped back up. I was going to ask you a question for you, but since you got your hand up there, I will let you take it away.
Hi, Dr. Traxler. Thanks for taking my question. What happens if another surge or another variant comes about?
And so that is something that we continuously monitor for. And I can't promise that it will not happen. Certainly viruses, this virus is behaving as viruses often do, where the next variant, we would anticipate and certainly hope that it would be, while it might be more contagious, it would be causing even more mild disease, that it would be causing even less severe disease. And so that's where getting vaccinated and staying up to date on vaccinations is going to be key, because we may continue to have variants emerge that are contagious and cause just mild symptoms in a lot of people, but don't cause much severe illness. But by getting vaccinated and staying up to date on vaccines, you can protect yourself very well against those variants and even causing the mild disease. And certainly we continue to monitor if this virus doesn't behave as viruses often do, then we will take appropriate steps and provide the guidance to the people of South Carolina for how to best protect themselves, just as we've done for 2 years plus now.
Thank you for your question, Lynn. Damien, I'm going to guess you remembered your second part of your two-parter.
Bingo, found it in the notes here. I know DHEC was facing a couple of data input issues in the past couple of months. Does the change in data reporting have anything to do with that at all?
No, it doesn't. Those have been actually, those processes and such have then been permanently fixed for those. So those are not part of what's factoring into the changes in data reporting. The changes in data reporting are being affected by what is appropriate for public health, for guiding public health action, and by what we are seeing with the virus and the trend towards more endemic.
Thank you for the question. Julia, go ahead with your follow-up.
Hello, thank you. So as far as sort of waning down the testing sites, I didn't know if you were able to give an example in Columbia, like how many sites would be shutting down, what will still be open for the public to go drive up to.
Sure, and I do not have that information off the top of my head. But as we put in the press release, it's going to be based on how many PCR sites are available in that area. So we're going to be looking at counties and how many PCR testing sites other than ours, are in that county. And so I would imagine that Richland is going to be one where we're going to be, gradually decreasing and closing our the DHEC testing sites, because I do anticipate that there are a number probably of other PCR testing options. But again, at the same time we're decreasing our PCR testing sites, we're still making available at every DHEC health department, and there's at least one in every county, the free at-home rapid antigen tests. And we'll be doing other efforts to get those out into the community as well. But the main thing is people knowing that they can go to any DHEC health department and get an at-home rapid test.
Thank you for that. Keeping with my strategy of letting people ask their first questions first, Madeline, go ahead, please.
Hi, thank you. Dr. Traxler, I was wondering if there is another surge or if we have another situation like we did around Christmas where there's a shortage of at-home tests, testing lines are out on the streets. How fast are we going to be able to get those sites back up? Do we know?
And so I think that we are anticipating that there's not going to be a shortage of the at-home tests. Certainly, many things can happen outside of our control, but from talking to vendors and everything, we are confident in our ability to continue to get a supply of rapid at-home tests. So even if we see another surge, our first tool is going to be still those rapid at-home tests. Because again, people can get the answer quickly and take that important step of isolating themselves from others without spreading it further. And as we've seen with our variants over time, that incubation period, how long it takes between when you're exposed and when you're contagious, has been decreasing. And so really it's important more and more for folks, to know that they're infected and quickly to be able to isolate if they are.
Thank you for your question, Madeline. Vanessa, go ahead with your follow-up.
Thank you. Dr. Traxler, you mentioned the importance of staying up to date with vaccinations. I was just curious if you had heard anything specific about, the possibility of a fourth dose or an additional booster for folks, because I'm thinking, many folks who got, the first available boosters were boosted back in early fall. So, we typically see waning of, effectiveness as any vaccine does. It looks like some people could possibly be due again soon.
And you are correct in looking at the timeline. However, I have not heard anything. We know from data that these vaccines continue to protect very well against severe illness. And so while the protection may decrease over months in terms of the ability to protect against infection, they are still very effective at preventing severe disease. But we continue to keep up to date on the data, to stay in touch with the federal partners that are in communication with with, certainly the larger data sets and looking at that as well as with the pharmaceutical companies, that they're giving guidance to the pharmaceutical companies if they see the need for new or different or more doses. But at this time, I have not heard anything, concrete or even really as a rumor about potential further doses.
Thank you for that question. And what will be our last question and follow-up of the day, Lynn Riddle, go ahead, please, ma'am. Lynn, you got anything for us?
Yes, I'm sorry, I was muted. You talked about the availability of the tests. I was just wondering how many you have on hand now, and is there a limit to the number that people can get?
So we continue to receive, and I know even just here recently have been pushing out, I think probably over 50,000 just went out in one day this week to our health departments. And I was being told that we had literally in the hundreds of thousands more available. So, and they continue to come in and we continue to process them and push them out to our health departments. We still are at this time saying one kit, which is 2 tests per person, but certainly that's something as our inventory increases that we'll be looking at, and any of the rules regarding people being present, et cetera. I do know that we're going to be setting up a program for those homebound individuals to be able to mail them directly their test kit.
Thank you for your question, Lynn, and thank you for all the questions that we received today. We very much appreciate the work that you do covering COVID and the time that you took this morning to be with us. And Dr. Traxler, I'd like to thank you for your time and helping explain this change in our testing strategy. And if anybody has any further questions, we always stand willing to help you do your best work. So reach out to us if you need us, and we'll be here. Thank you so much for your time, and we'll talk to you soon.